Senator from Arizona.
Mr. President, today the Health Committee will meet to discuss another new government program that seeks and is advertised to promote prevention and wellness. While prevention and wellness are important, can lead to lower overall health care costs, we already have several programs focused on wellness and prevention. The HHS appropriations request for prevention is $700 million. In the recent omnibus appropriations bill, there was $22 million worth of earmarks for legislators' pet projects for prevention and wellness, and $310.5 million worth of earmarks under the Health Resources and Services Administration. Yet the health care bill proposed by the majority includes $80 billion new spending on new prevention programs without even acknowledging the existing programs or suggesting improvements to them. In other words, wellness and fitness has become another trough to put both feet in for earmarks and pet projects of members. We already have $1.8 trillion in federal debt. Majority keeps on spending on new government programs that intervene in the markets and our personal lives. My question is, where will it stop? The Center for Disease Control has devised programs focused on weight loss and obesity, smoking and tobacco, drinking and alcohol, injury and accident prevention. These programs receive hundreds of millions of taxpayer dollars each year. But the health reform bill being considered by the Health Committee adds billions more for prevention on top of these programs. Reckless spending that's going on is irresponsible. We should be focusing on whether the existing programs achieve their stated objectives. The federal government does nothing to measure effectiveness of prevention programs, has not a single metric for program performance. Before we create a new federal entitlement program costing billions, we should first measure the effectiveness of our current programs. And I can tell you what is working. I can tell my colleagues what is working. Employers all over the country are creating innovative voluntary programs to promote healthier lifestyles and bring down costs. Safeway is a great example without a government program. So instead of removing hindrances to more employer prevention and wellness programs, the Health Committee first instinct is to create another government entitlement program and set up roadblocks to employer innovation. I would now like to take a moment to put all this in perspective. Today is Tuesday, June 23rd, and another day has passed without the Senate having a complete health care reform bill to consider. We don't yet know what the majority will propose for their so-called government plan or how it will be paid for. What we do know is that a Congressional Budget Office preliminary estimate believes that the incomplete bill will cost over $1 trillion, but cover only 1/3 of those currently uninsured. So I'm very interested in the Congressional Budget Office cost estimate of a complete bill. Some fear that the final price tag for covering all Americans could cost taxpayers as much as $3 trillion. We have a real problem here. Every day that goes by without the key elements of the Democrats' bill being available for consideration leads to another day where millions of Americans will become uninsured. This is a disservice to our constituents and an embarrassment. Mr. President, the President of the United States and the majority continues to allege that we will enact health care reform before we leave for the August recess. We are now approaching the July recess. We do not have an estimate or the language, much less the estimate, of two vital important parts of any health care reform legislation. What will be the role of the employer and what will be the government mandate or the government role? And finally, how much all this will cost the taxpayers. So we're talking about 1/5 of the gross domestic product of this nation and we are expected in a few short weeks to enact overall health care reform with still the members on this side of the aisle not being informed as to what the plan is, much less have a serious debate. Now, there are meetings of the committees going on and discussion and nice things said about each other, and I always enjoy that. But the fact is, we haven't gotten down to the fundamental challenges of health care reform in America, and the days are growing shorter, and the time is growing short. And, Mr. President, we cannot enact health care reform and fail. We cannot do that. So the sooner we get the full perspective of what the administration and the other side's proposal is and how much it costs and what the fundamental issues are being addressed, such as employer mandates and government mandates, are certainly not clear, not only to us but the American people. We have to communicate with the American people how we're going to fix health care. We can't do that unless we have a complete plan to consider and present to them, as well as members on this side of the aisle. Mr. President, I yield the floor.